Bismillahirrahmanirrahim. Assalamu alaikum students. We continue our discussion on the topic of inflammation. Students, as you already know that there are four characteristic signs of inflammation. That is redness, swelling, increased temperature of the local area, and number four, loss of function. Students, the main mechanism behind these four cardinal characteristic features is the presence of inflammatory mediators. What are those mediators, from where they are produced, and what are their actions? We are discussing them. So students, first of all, we have got histamine. It is the most potent mediator of inflammation. It is released by mast cells, basophils and platelets. The main action is vasodilatation, and this vasodilatation mainly start at the smallest level, that is arterioles level. Secondly, increased vascular permeability. After histamine, we have got serotonin. Students, serotonin is released by platelets. Serotonin also produces vasoconstriction. Initially, there is vasoconstriction to stop the bleeding at the site of injury. Later on, there is vasodilatation. So, I repeat, histamine causes vasodilatation, that is increased caliber of the blood vessels, and serotonin, it causes vasoconstriction, that is decreased caliber of blood vessels. After that, we have got prostaglandins. Prostaglandins are produced by mast cells and leukocytes. Students, prostaglandins produce pain, fever and vasodilatation at the site of injury. Now, platelet activating factor. Platelet activating factor is released by mast cells, leukocytes, and again they perform the function of vasodilatation, increased vascular permeability and chemotaxis. Next, we have got reactive oxygen species. Students, reactive oxygen species, these are the products which ultimately form reduced superoxide ion. They consume oxygen to produce superoxide ion. They are produced by leukocytes and they perform the function of killing of antigen or offending microbial organisms. Next, we have got nitric oxide. Nitric oxide is produced by endothelium, that is internal lining of the blood vessels, and macrophages. Students, as a result of nitric oxide release, there is increased vascular permeability, there is vascular smooth muscle relaxation and killing of the offending microbes. Now we have got cytokines. Among cytokines, the important ones are tumor necrosing factor, interleukin 1 and interleukin 2. Students, these cytokines, these are the inflammatory products of macrophages and mast cells. They produce fever, hypotension and shock. Now the next one, we have got chemokines. Chemokines, they are produced again by macrophages and leukocytes. Students, next we have got leukotrienes produced by mast cells and leukocytes. Again, they perform the function of increased vascular permeability. Complement proteins. Students, complement proteins are produced by the liver and they are involved in killing of the offending antigens. Lastly, we have got kinins which are produced by liver and again they perform the function of increased vascular permeability. So, to brief, the main mechanism of inflammation is produced as a result of action of these inflammatory mediators. Students, as majority of these inflammatory mediators are produced by leukocytes, that is white blood cells, and macrophages, so we can also call them as injury produced by macrophages or leukocytes. Thank you students. Allah Hafiz.